A growing shortage of sexual assault nurse examiners, also known as SANE nurses, is causing concern across Michigan. There are delays in getting survivors the critical care they need. These nurses collect forensic evidence and perform the exams. There is a nonprofit organization, though, working to change this barrier in West Michigan, as Erin Sullivan reports.
The I'm Safe Children's Advocacy Center is now offering free around-the-clock forensic exams for children in Ionia and Montcalm counties, helping remove major barriers for families in rural areas that they've faced for years.
Since we've been out here, we've done over 2,500 cases with children.
Lori Kirchhoff is the executive director of the I'm Safe Children Advocacy Center. She says she's been working with sexual assault survivors in the area since 2015.
That's a lot of children for 10 years that we're talking about.
And now they're partnering with Michigan Mobile Forensics, something they could have only dreamed of just a few years ago.
So we had no idea when first starting, but obviously once we started seeing how many there were and the time it was going to take, we knew we needed to grow.
Their new program provides their facility with a sexual assault nurse examiner, often referred to as a SANE nurse. The program provides 24/7 examinations for children in Ionia and Montcalm County, which typically has been a difficult service to access in the past. In order for a patient to receive a SANE examination, their hospital needs to have a certified SANE nurse. This specialized care typically can't be provided in rural communities due to an ongoing shortage of certifications. So in order to get an exam, patients need to drive to Grand Rapids or to Lansing.
Then they find out they now have to go to a different facility, which is for many people an hour away, to drive. That can be a huge barrier for them.
And it can also make some traumatic situations even worse.
So now the anxiety is building. Oh my gosh, I'm going to another facility. I don't know what that looks like. I have to sit in the car for the whole hour with my parent, and this has just happened. And so sitting in those clothes that they just wore during that sexual assault, not being able to shower, all that does add to the trauma that the child is enduring during that time.
I'm Safe CSA now has their own examination room with a SANE nurse always on call, something Kirchhoff says is a step in the right direction.
And so now we're removing those barriers by having our own medical suite here with the Sexual Assault Nurse Examiner program. All around, we're just very excited to be able to offer this service. We obviously don't want to have a service like this, but if you have to have it, it's great to have it in your own county where it's local for everybody to use.
I'm Safe CAC will provide advocacy services and follow-up support for every child that they work with. And their new services, they can continue to create safe and resourceful centers for survivors. In the newsroom, I'm Erin Sullivan, 13 on your side.